We will be today terminating our relationship with the World Health Organization and redirecting those funds to other worldwide and deserving urgent global public health needs. The world needs answers from China on the virus.
Peter Mathews is a professor of political science at Cypress College in California, and he joins us now live from Los Angeles. Thank you so much for joining us on the program. Now, what does this move that Trump has taken mean for the WHO and for the U.S.?
It's a big mistake, and I think even the American Medical Association has said it's senseless and illogical, and they're right, because why should the United States be withdrawing at this time when we have a worldwide pandemic? And frankly, WHO was established by the United Nations back in 1948 to coordinate health policy throughout the world, but it's got a very small budget, and most of the budget is not guaranteed. About 23% is guaranteed, but it can coordinate by putting out information and looking for diseases and spread of diseases, and then it can make advisory opinions. And it's not bound, the country's not bound to follow them, but the opinion is very important, and the declaration of a pandemic is very important. These are very, very crucial roles that the WHO plays, and for President Trump to withdraw now is a big mistake and should not be done. He should get back in it again and fund it fully.
Do we know how much the U.S. funds the WHO? Do we know the numbers at all?
Yes, I do. It's about $400 million a year, and China does fund it about $40 million a year, about 1/10. But still, the WHO budget is about $3.9 billion a year. 23% is guaranteed. The rest of it's through voluntary contributions. So it's doing the best it can with the limited resources. And the U.S. funding of $400 million is not a lot of money, considering the United States is the world's number one economy. And they should actually increase the funding at this point with the pandemic, because it's so important. WHO actually helped to come up with the first test kits. The German branch came up with the first testing kits that many countries used early on. The U.S. didn't. The U.S. chose to rely on the CDC kits, which were actually defective for 2 weeks. That set us back. And President Trump didn't jump on it right away, as South Korea and Germany did, to have widespread testing and to get on this pandemic. And WHO could have been a big ally in this if he would really work with them.
Now, I just want to take a moment to focus on Trump's remarks towards China. He's blamed China for not being transparent about how COVID-19 was formed and the overall situation there. How transparent do you think China has been, and should people be cautious about the information coming out of there?
Well, on December 31st, China made a declaration to WHO and the world about this coronavirus being in their country and being a very great danger. By January 14th, the WHO said that they could not rule out that there was human-to-human contact. They said it's a very good possibility. And on January 20th, when the WHO team went to China, and 20th and 21st of January, they concluded that human-to-human transmission is occurring. So as early as January 20th, President Trump and the whole world knew through the WHO that this is a human-to-human problem, and the pandemic announcement was made at the end of January. So President Trump had a lot of time to right away move forward, but he didn't do what he should have done. There were things, for example, like the testing kits, the ventilators. He could have used the Defense Production Act to actually force the corporations here in America to build ventilators. He didn't do it. He just invoked it, but didn't use it. So there's a lot of delay at the beginning, and there's much criticism right now about the president's reaction. He's trying to blame China, blame WHO, and blame everyone else but himself. I think he needs to get on it and really follow the advice of his experts and get things done right now, if it isn't too late. It's never too late, but it could be. The fact is we should have acted earlier to alleviate some of these terrible suffering and death of over 100,000 Americans so far, the largest of the entire world's death rate.
Indeed. Peter Mathews, thank you so much for that insight, as always.